what we're going to do is basically a short intro, say hello to you all, and then also go through all the questions that have been sent in via email, and then we'll open up the chat and talk through any of the questions that you have. So just to say welcome, we hope that you'll find this all very interesting tonight. And I'm Dr. Tamsin Lewis, and I am, as you all know, have suffered from long COVID for 13 and a half months now, not that we're counting or anything. And I'm a medical doctor, trained at King's College, then a postgraduate degree in training in psychiatry, and then further training in functional medicine. So the reason for us putting together this support platform, and I'll talk a little bit to let Andrew have the stage in a minute, was basically as a result of my own journey, even as a medical doctor, not being able to get access to information. And if you listen to the videos, you'll understand that, so I won't spend too much time on it. But the whole point of today is to really, approach the questions that you've answered and try and get you some answers and access to diagnostics and further help. So over to Andrew, who is my colleague and friend.
Thank you, Tamsin, and good evening to you all. Thank you all for joining us on this session this evening. It is our first one, so we're very much keen to see how it all goes. I'm Andrew Greenland. I'm a medical doctor as well, friend and colleague of Tamsin. I've had my foot in both camps regards to COVID. So I've been working on the front line throughout the pandemic, going back to last March in the emergency department, so seeing patients really quite unwell with acute COVID, but I also do integrated functional medicine, and I'm seeing patients with long COVID and the more chronic aspects of their illness in that setting. So I have two foots in both camps, doing different things. On the one hand, doing the life-threatening, the life-saving intervention on the one hand, on the other hand, trying to help people through this very difficult, complicated illness. So that's me, and this evening is all about trying to answer some of the questions that you've asked, some of the things that are bothering you, try and give you some answers and some access to where you can go for further information. So, this is really all about you this evening. So thank you very much for joining us this evening. And should we kick off, or is there anything else you want to add before we start?
I am just checking that you can all hear me. So just to ask everyone if you can all hear me, because I think we're on mute for a while, but now we don't appear to be. So I just wanted to say that there's a Q&A function at the bottom of the screen, which during the time that we talk through your questions and answers, please do add any questions that you have there, and we will endeavour to answer them at the end. Okay, great. So yeah, we can kick off on the questions that we have and go from there.
Okay, so we've had lots of questions coming in, so great, thank you for contributing, really helpful, because this is all about you. What I've done is to kind of group them together, because there are some really resounding themes throughout your questions, and we'll try and sort of tackle them together and give you both of our perspectives on things to hopefully give you some clarity. So the first one is really about prognosis, and it says, do you know any full recovery stories from those who are ill with COVID last March? So Tamsin, if you want to kick off.
Yes, sure. I mean, this is the age-old question we're all looking for. Sort of one big answer is, are we all going to get better? And I can, honestly reassure you that there are people that have made a recovery who are back to their what they deem as their pre-COVID self. I think it very much depends on your pre-COVID baseline. The health that you had going into it, the level of functioning. But I have access to some of the patients that I've seen, some of the experts, some of the consultants that I've been speaking to have for sure had people return to their pre-COVID selves. I think using my own case in particular, and I know that there's many people who are potentially quite athletic or fit before they had COVID, and therefore are not back to their pre-COVID self. And that is certainly the case in my instance. I can certainly live life, but I cannot run. I cannot, exercise with any intensity without getting hit by post-exertional malaise. And we'll come to that with the whole concept of pacing and exercise, etc. But I think what we are seeing, well, I know what we are seeing now is sort of a gradual, step-by-step change in functioning back to being the version that you were in your pre-COVID self, in some cases an even a better version, because we've been forced to change our lifestyles and often dietary habits, etc., which can result in us being potentially a bit more healthy. So it isn't all doom and gloom out there. I think there is an aspect to this, to the long COVID illness, where fatigue is predominant. I think we are being forced to adapt our lives, not just change them, to account for this chronic effect of the illness. But I think one thing I want to really state from the outset is that long COVID isn't the same illness, as you all are probably aware. It's not the same illness for everyone, and there are very different aspects of it, which we will come to now.
Thank you. And so from my side, yes, I totally agree. And I've seen many friends, colleagues, family members, and my patients who have made a recovery from COVID. I think this is interesting because there's two questions here. The first question was about COVID in general, and then it goes on to talk about long COVID. And I think it's worth mentioning that for most people, and this is not much of a consolation to a lot of you on the call, that the acute COVID illness, for most people, they do make a full recovery. And I've had lots of people that were very unwell at the time with the acute respiratory illness who've made a full recovery. I suppose why we're all here today is to talk about the long COVID situation. And I am seeing people recovering. It's slow. We can't say how long it's going to take, but I am seeing people that I'm first started treating last March who are really coming through this. So in answer to your question, yes, people are making a full recovery. It's just a bit of an uncertain journey. And I think it'll become easier to navigate as we get more information, more studies, more research, more treatments available to help us really work out what's working and what's not. But it's very much a kind of a trial and everything for us all working in this field. But I think there's definitely hope out there. And that's one of the reasons I wanted to put this question first, is to really give you all some reassurance on this platform that this is not all doom and gloom. There is really some hope for the future, and don't give up.
Yeah, it's very frustrating, I think, for all of us, because you have days when you feel better and you're able to do more, and then you feel like you're over it, and then you end up back where you were. But I think as time goes on, we're learning more and more, and the fear that we're going to descend further and get more unwell is actually lessening. Clearly, there are always cases in the news, etc., where you read cases about people becoming severely unwell months afterwards, but they are definitely the exception. But as we are seeing, and we'll talk about more, you do need to be consistent in your approach and the way and the lifestyle adaptations that we'll come to, and also the different treatments. So yeah, on to the next question.
Okay, so there's a couple of questions on vaccines, and we're not going to go into this in much depth today because we really think this deserves a whole session on its own. There's so much talk about vaccines at the moment. There's lots of worries and scare stories out there. So we're going to devote one of our webinar sessions purely to vaccines so that we can to embrace these. But I will just bring up a couple. Do you recommend vaccines for all long COVID patients, or do you think some groups with a particular set of symptoms may be contraindicated for taking a vaccine? And do you have any guidance on if there are any particular brands of vaccine to take or avoid? So you might just cover some of the kind of generic issues there, because it's we can't ignore the whole vaccine thing, but we just want to give it some more attention in the latest webinar.
Yes, exactly. Well, I can start with my experience with patients, and also my personal experience. So, we can't ignore the red herring, oh, not the red herring, whatever it is, the red fox. That is the AstraZeneca vaccine that, has been covered extensively. So I think it's worth saying that pretty much everyone I know who has had COVID and had the AstraZeneca vaccine has felt a reaction to it initially, which is akin to having a small dose of the illness again, but it very much is usually a small dose. So you can feel flu-like for a few days, headache, etc. And my own experience was I was pretty tired for 2 weeks. I had a headache, etc. I took increased dose of antihistamines, which helped. But then a lot of my symptoms, including the chest pain, lung pain that I had, did actually improve. And that is what we are seeing anecdotally. And you probably know Jez Medinger, I never pronounce his name, sorry, Jez, has done a survey on looking at long COVID and vaccines, and definitely the majority are having symptomatic improvement after the initial few weeks of which can worsen fatigue or headache, etc. So I want to say, if you have a choice of vaccine, for sure, a lot of people are looking at the Pfizer or Moderna, but often, in the UK, you really don't get a choice. I don't know if you want to talk a little bit more to that, Andrew. But for sure, it's worth getting the vaccine, because another dose of COVID, is a theoretical possibility. In some cases, it's more than theoretical. People have got COVID twice, as you know. And until we know more about T-cell memory, etc., that will always be the risk.
Thank you. And I would tend to agree with that. I mean, I've been working on the front line. I've seen the worst of COVID. And I think, if you weigh everything up, risks versus benefits, I think I would be on the side of taking the vaccine. It's not to say that I'm not listening to what's going on in the world and some of the things and the issues that are cropping up. But I think weighing everything up in my world and what I've had to contend with and my personal risk with working on the front line, I would be certainly on the side of taking the vaccine. You're right, I agree with you, Tamsin. It's not easy to get a choice because you're very much geographically located as to who's offering what in your local health system. So it's not quite so easy as dictating what you want. It makes it a little bit more difficult for us all. In terms of the people that probably should be a little bit more wary about vaccines, so if you've had any kind of anaphylaxis to vaccines before or the components in vaccines, it's one of the contraindications that the NHS are kind of advising us all against. I think if you're very unwell with symptoms, it's another reason probably why you shouldn't be having a vaccine right at that moment in time. Or if you're very, very debilitated with COVID, we would probably suggest holding off having the vaccine right at that moment, because what we don't want is to push you further down the line, because we do accept that there may be some symptoms that are causing an issue. And probably pregnant women is probably another group of people that we're going to be exercising caution over. Those are the main groups, and that was one of the things in the question about who it's a contraindication for. So again, we will come to vaccines in more detail on another call. And obviously, if you've got any questions about vaccine, please do send them in and we can make sure that we table them at that session. So actually, I've got another vaccine question. What are your thoughts on stories that people have fully recovered post-vaccine? I'm not entirely sure I'm certain of the question. But I am seeing a lot of people having the vaccine in the long COVID world whose recovery is accelerated. Tamsin, I was just saying, I've got another question here. It says, what are your thoughts on stories that people have fully recovered post-vaccine? I'm not sure I fully get the question, but I don't know if you've got a take on this.
No, I do. I hear this all the time. There's been, and the press like to pick up on these things. I haven't heard anyone exactly in person. They're all anecdotal reports of people having symptomatic improvement, but the press is certainly picking up on people having miraculous recoveries. I think it really depends on what your symptoms were before the virus, before you had the vaccine. Because the fatigue predominant long COVID patients don't seem to be recovering to the same extent that other people that have more of the residual lung pain, chest pain, potential organ damage. If we do go via the theory of viral persistence, then that the fact that you're getting an immune reaction from the vaccine, which is then triggering off some repair process or some virucidal, which is killing any residual virus in the body, then that can improve symptoms. But I don't think it's the panacea that we hoped for sure. Given my experience, people can feel better for a while and then not feel better. But again, it depends on your individual circumstances, your residual symptoms, whether you've had any investigations to look at any organ damage, any heart, any lung, any pancreas, any thyroid, and we'll come to that. But yeah, it's certainly not common to make a full recovery after having vaccines, sadly.
Wonderful. Okay, so our next raft of questions are really around symptoms, and I've grouped these together because what we're realizing is that you all out there on this platform, but also in general, have a vast array of different symptoms in the long COVID situation. So some of these are overlapping, some of them are quite complicated, but we'll see what we can do to try and give you some guidance. So the first one is, I'd be interested in finding out if anyone has struggled with mouth and tongue sores, strange white lines forming on cheeks, relapses with neck pain, back or neck, any loss of nails that look like they've been bruised or traumatized. Is the first one.
Yeah, we looked at that one, and that question, and whoever you are, I hope you're listening in, because I really wanted to say I feel for you, because so many of the symptoms that come and go with long COVID are absolutely destabilizing, distressing, and anxiety provoking, because you're literally, we don't really understand where they're all coming from. I think it's important to say that there are a huge variety of dermatological sequelae, so effects of COVID, that you've probably read about, and everything that you've mentioned here, mouth and tongue sores, so this kind of blistering in the mouth, white little lines forming on the cheeks, all of that can be a result of immune system on overdrive, which we often see in COVID. We know that people with long COVID seem to have an overreaction of their immune system in many cases, and that can be not just COVID antibodies, it can be looking at other what we call auto antibodies, and sometimes as part of that reaction you can get an inflammatory reaction in the skin, in the mouth, any of the mucous membranes can be impacted. I think it's important to rule out, especially in this case, whether you have got things like oral thrush, for example. Candida can present with some of those symptoms, but that would require, you can have a GP look at it. You can use, saline mouthwash, which can really help heal things. You could potentially use a chlorhexidine, which is a mild antibacterial, but I would definitely get that looked at. I think other things like loss of nails, I would really want to do a full blood panel to look at any nutritional consequences of COVID. And that can be, and I often see this in patients, because COVID is a stressful event, it does use up your, what we say, antioxidant defenses. And so sometimes one of the things that we can measure in a blood test could be looking at things like the vitamin B12 levels, looking at your iron levels through something called ferritin. Looking at your white blood cell count to see if you've got any evidence of low white blood cells now, which can cause opportunist infections like Candida, like yeast to pop up. So I think asking for a full blood count, potentially looking at your iron, your B12 and folate can be important. The next one you've mentioned is, but it's probably in this context, it's worth saying that, because hair loss is a really common one as well. It is likely that this is related to the amount of stress that the body's been through. We know that stress can really trigger hair loss and other things like loss of nails, tinnitus, which we'll come to next. So I think I want to assure people that if we can learn to work well with this illness and try and reduce our overall stress levels, then hair will grow back, nails will grow back. They're kind of non-essential organs, as they were. We don't need to have nice, hair. It can be, it's something that in the scheme of survival can be left to the side. So once stress levels have reduced and we're not fighting the acute illness, I think over time things will stabilize again. So I think the next one, they're looking at tinnitus. I mean, a lot of people with long COVID have tinnitus. I had horrendous tinnitus right from the start. And I know how much that can impact you. And I think it's important to say that, again, stress as an overall concept and term can really play into tinnitus. I notice when I do more yoga and breath work and not have as much life stress, that tinnitus can improve. I think it's important to say that we do think that COVID can have a direct impact on the nervous system, of which the brain, the inner ear, etc., is one part. And that can cause this inflammation, which we know long COVID is. It's a general inflammatory state in many people, and that can result in tinnitus. Now, we'll come to treatment shortly and the antihistamine protocols, but many of the symptoms that you've mentioned here as well, hives and joint pain, etc., and skin rashes, can all be histamine-driven symptoms and therefore helped by an antihistamine approach.
Thank you. And I agree. And the thing with a lot of these symptoms is that any one of these symptoms could have any number of causes. And so yes, we can put everything down to COVID, but we always, as doctors, like to say, is there anything else that could be causing this that's reversible, that's treatable, that we're missing? So, Tamsin talked about, things like the hair loss. There's so many different things that cause hair loss. Even if your thyroid isn't working properly, there's lots of things that can contribute. And we prefer to rule these things out before we put everything down to COVID. But I suppose the important thing to remember is that COVID is a systemic infection, and it can literally affect any tissue. So we talked about brain neurology, so the nerves, particularly around the ones in the inner ear, which can give tinnitus. Literally any tissue in the body, there could be an effect. And so it's not surprising when we see this really vast array of symptoms across all of your bodily systems. Just out of interest, I think there was a question about tinnitus post-vaccine. And interestingly, the MHRA, who record all adverse effects from vaccine, have recorded 1 in 24,000 people are reporting tinnitus post-vaccine. So it's not an uncommon problem, it's being picked up. And I think it just helps you to know that there are other people out there having this and you're not completely unusual. So not just the illness itself, but actually as a post-vaccine event. Now, it might not be caused by the vaccine, but it's a reported event. So the MHRA are picking up on these things. So yeah, just really about just checking for underlying causes. Stress, big key player for most things. Stress affects just about anything. If it suppresses your immune system, that can manifest in all sorts of ways. So trying to manage and reduce stress levels where possible, and that's difficult because you're managing a chronic illness, which is inherently stressful, but it does have a big part to play. Okay, our next question. Apart from fatigue, although this has improved compared to 2020, I get lightheadedness and tightness in the head when in social settings for more than an hour. I also get burning eyes when reading on screens and watching TV. What do you think this is, and how could it improve?
Sorry, I just missed the first bit. So I heard eyes when watching TV, dry eyes.
Sure. So it's about fatigue, which has got a little bit better, lightheadedness and tightness in the head when in social settings for more than 1 hour.
I think that I talked about this with Jazz last week at this whole concept. I will send a link out to listen, because I think a big part of long COVID, as you know, is this concept of, or you may not know, I'm sorry, is dysautonomia, and that is an overactivity of the sympathetic nervous system. And that can result in a number of symptoms, of which this sort of tight head, which can be akin to a tension headache, so muscular tension around the scalp and the back of the neck. So that can be triggered by a sympathetic nervous system reaction. So again, the overall arcing term is stress, but there are ways to deal with it. And we know that doing box breathing before going into a social setting may help, because that activates the parasympathetic nervous system function. And all that is in for 4, hold for 4, and out for 4. So really trying to calm your sympathetic nervous system there. I think as this relates to the dry eyes as well, the inflammation that we know generally in the brain and the nervous system can affect the neurotransmitter function and choline function, which can affect your lubrication of your eyes. So if you know that is something for you, then I would advise getting dry eye drops, either from your GP or from the pharmacy, and really just trying to blink a lot to try and encourage the fluid turnover. You may want to do a little bit of massage around the eyes too, because that just helps the lymphatic drainage. But yeah, I can understand how that can be difficult. I've experienced much of this, and I was also given a trial of propranolol, which is a beta blocker, which is meant to tone down the sympathetic nervous system drive. So COVID seems to be very good in a lot of people at triggering these adrenaline and other related substances to flee into the blood and cause the raise in heart rate, this kind of blood pressure change, which you can perceive as dizziness. That's sort of a sitting to standing, you can become a bit dizzy. And there are multiple ways of dealing with dysautonomia, depending on which symptoms you suffer from. But I was told to have a high salt diet, which you often don't hear from a doctor, but it can really help with what we call POTS, postural orthostatic tachycardia syndrome, which is basically lying to standing, an increase in blood pressure and other symptoms like dizziness. So if you increase your salt and your fluid intake, that can often help. So those are just some of the mechanisms. So really do watch the video with Jez. He's run DMC on YouTube. We'll send a link, because we explore this whole concept of dysautonomia with a guy called Ashok Gupta, who's set a program for people with chronic fatigue and long COVID, which really tries to embrace the parasympathetic nervous function, parasympathetic nervous system function, to get our systems to get out of this stress state, to really wind down and allow us to heal a bit better.
Wonderful. So I've just got a little slight tangent on this one, because the question mentioned about burning eyes when reading on screens and watching TV. So with my sort of integrated functional medicine hat on, I know we've all been shut down inside for the last year, and we're all doing a lot more screen work. But just remember that the blue light coming off screens is something that will interfere with your sleep. And somebody who's chronically fatigued, who's not sleeping and resting properly, who's possibly getting overstimulated by watching too much stuff on TV, on screens and research and everything else, just a little bit careful about your screen use, because you really do need to get restful sleep. And we know blue light interferes with sleep. It actually interferes with your melatonin production, which is your natural sleep hormone. So a couple of things you can do is just to try and have a bit of downtime from screens in the evening, if that's possible, or actually some blue light blocking glasses to minimize the effects of the blue light and the interference that causes. And the other thing is that if you are staring at screens a lot, then it does make your eyes more gritty and irritated and sore. And maybe some symptomatic treatment with an eye bath, eye wash can be quite helpful, just to settle down the sort of dry eye symptoms. But I agree with everything that Tamsin said. We are also exploring this more widely, and the dysautonomia is a really relevant factor for some of the symptoms that you mentioned.
Really find salt water, even just saline drops, or sometimes I have to take a magnesium salt bath at night. That just really helps. But clearly blue light in the evening is a problem. I use something on the computer called f.lux, which is a free software that takes the blue light out of the screen. You can wear the orange glasses, the amber tint, but try and keep your environment in the evening nice and almost like candle lit, because that is how we evolved as a species. So I cannot emphasize how important it is to be able to try and get deep sleep, because that is when we will be recovering. And I know that sleep is certainly a problem with long COVID per se, due to some of the things that we've talked about already with this sympathetic overdrive.
Wonderful. Okay, next question is, I get tired and ache, then crave sugar. And the question is, should I avoid sugar?
I often, when people ask me a question about sugar, I often think, well, what is sugar? What do you crave sugar? Do you really just spoon sugar out of a cask of sugar, or do you eat Frosties? What do you eat? Because often it can be more about what you then end up eating rather than the sugar per se. All right, so that aside, was the initial question, sorry, I missed it. You get shaky and tired and then
I get tired and ache and then crave sugar.
So I think this is what we see in long COVID too. So it's probably, and any of these post-viral syndromes, we become less efficient at producing energy due to the effect, we think, and this is what research is and will be looking at a lot further, and a lot of the work that Dr. Myhill has done on chronic fatigue and over the years is focused on the role of something called the mitochondria, which are famously or generically known as the powerhouse of the cell, these little organelles in the cells that take in the fat, the carbohydrate, the proteins, the breaking down products of that, and out comes energy. So as a result of the cellular damage and oxidative stress that viruses can cause, those mitochondria don't work as well. So the output means that we can't fast for as long, we feel shaky potentially, et cetera, et cetera. So what I try to get people to do is to have steady release of energy, so that they're not, and this is hard because people are being told to fast to cure long COVID, but I think it's really important to mind your mitochondria, and there's much written on that subject. So please do look into that, the whole role of the mitochondria, and we'll touch on it again in healing from chronic fatigue and post-viral syndromes is so important. And that means, ensuring that you're having a mix of fats, carbohydrates, proteins and 3 meals a day. I would advocate for an overnight fast, 12 to 16 hours. I think that's good to give the digestion a chance to rest and reset. But that will prevent you having these swings in glucose, in sugar, blood sugar, which is then triggering you to get the easiest source of energy available to it, and that is simple sugars. If you do feel that way, then I would encourage you to have a banana, potentially with some peanut butter. That's always something I have in hand. Try not to have sugar on its own, because all that's going to do is make you feel better for a short period of time. They're going to feel worse again. And what I've learned through using a continuous glucose monitor, I use these with patients quite often. I've got the result of one here. So it's like a little patch, and you stick it on the back of your arm and it links to your phone. You can see in real time what your blood sugar levels are doing, and that can show you, you know, what foods are good for you and what foods aren't. So what you really don't want is this roller coaster. So for you that's feeling like really heavy and craving sugar, and that will be as a result of like mitochondria not working as well, but also build up of things like lactate from any exercise or any movement that you've done. So I often encourage people to, you know, have a warm salt bath, not a hot one, because that can tax your cardiovascular system. Or you can invest in an infrared sauna, like I have, like just like a pop-up one that you can get via Fairzone, which encourages lymphatic and blood movement through the body, and that can help clear some of these metabolites, these, you know, toxins that are building up, and help too. So blood sugar stability is key. You can either get a glucose monitor, ask us if you want us to get one for you, or you can just aim to stabilize your glucose over the course of the day by eating regularly, but a mix of carbohydrate, fat, and protein. So for example, at breakfast, it could be, you know, sourdough toast with an egg or some peanut butter, and maybe a couple of dates or apricots or banana, etc. And then having something again 4 or 5 hours later, and then again in the evening, and that should help. And when you do crave sugar, try and go for the slower release carbohydrates, like a banana, for example. I think it's important, and we'll come to supplements. You can work on your mitochondrial function through use of certain supplements like alpha lipoic acid, transfer factors that can support, amino acids that can support this mitochondria to work a bit better. So we'll come to that as well, because that can help you produce energy better from food again.
Thank you. I haven't really got much to add to that. It's exactly what I would have said. I think trying to maintain steady blood sugar levels is what I try to do for most of my patients in all settings, not just people with long COVID. We don't want these spikes in blood sugar, because yes, the sugar may give you an instant gratification, make you feel good, and then it will come plummeting down. When your insulin response kicks in, your blood sugar will crash, and then you'll need your next sugar fix to lift it up again. So all the things Tam was mentioned are absolutely right. Things that try and keep your blood sugar level steady. So, you know, protein, fats, complex carbohydrates, trying to eat as regularly as possible just to keep that blood sugar level steady, and try and avoid these foods that really shoot the blood sugar up. So these quick, you know, sweets and cakes and all the things that people like. There's also other reasons why people's sugar fluctuates. So again, stress, and we've talked about stress a lot today. If you're under a lot of stress with this illness, then it's going to spike your blood sugars and send them all over the place. Thrush is another, or candida infections is another reason why people crave sugar. And so if you've got a dysfunctioning gut and you've built up a yeast backlog in your gut, that can also make you crave sugar, and that's worth looking for as well. And then the mitochondria, it's all about the mitochondria. We know that long COVID is going to affect the mitochondria, the virus affects the mitochondria, and we're trying to give the mitochondria clean fuel. And the thing about sugar is it's what I would call dirty fuel. It leaves a trace of free radicals which cause damage, and the mitochondria are very, very susceptible to that. So we're just trying to keep everything clean for the mitochondria so they can release energy, which is what this is all about, giving you more energy in this situation when you're completely depleted. So I agree with really everything that Tam has said. Nothing really very much to add, just to reinforce those points.
I should probably state, because it is something that Sarah Myhill talks about, and I've done my own experimentation with, and happy to explore this further, is around the ketogenic diet and how that can help with inflammation and neural inflammation. And I have used what they call exogenous ketones, which are ketone drinks and ketone salts, to boost your ketone level. So it's difficult when you have mitochondrial dysfunction to metabolize fats for fuel well. So adding in what we call exogenous through drinks and supplements, etc., can support your ketone level, which can have benefits for neural inflammation. but that's a whole topic in itself. And if people are interested in the role of ketosis and fasting in healing from chronic fatigue and long COVID, then we can address that. I think it's just important quickly before we move on. The person that asked, Leah, asked about burning eyes, and has seen an ophthalmologist. I think it's important that in line with this auto-antibody response that some people get in long COVID, it's important to have ruled out autoimmune issues like Sjogren's syndrome, etc., which can cause burning eyes, because you've written that your ophthalmologist ruled out dry eyes. So, you know, it might be that you want to have him consider Sjogren's syndrome, which is an autoimmune disease. Anything else that you want to add there, Andrew, if people do have symptoms of autoimmune disease?
Again, it's going to be something that's going to need a medical checkup, and perhaps for some people an autoantibody screen to see exactly where they're at, because it's amazing what you can pick up on one of those screens, and you can really intervene very early in an autoimmune illness before it develops into something. So those early autoimmune screens can be really helpful if we suspect somebody in that situation. I
agree. So if you've seen an ophthalmologist and that hasn't been done, I would press for that to be done, or go back to your GP and ask for a rheumatology opinion.
Okay, we'll do one more symptoms, then we're going to crack on through, because we want to get through lots of the other questions. And this is a slightly different take. It's about heart symptoms. So if my heart seems to be improving over months, but I still exhibit mild heart pain, or very rarely now, extremely brief incidents of racing, do you have any particular supplements or treatments you would recommend? And do you think I can still get back to baseline?
Yeah, I feel for you here. I've had that. It was horrendous. And given I wear an Oura ring, there's no hiding from it. I could see that the heart rate is up and the heart rate variability is down. I mean, you know, it's really important to have investigations to rule out any of the things that we know COVID can trigger. It is not, you know, I have to say the majority of people who get an ECG, an echo, a cardiac MRI, do come out with a normal result, even if you have these persistent symptoms of heart pain. And, you know, I still have pain in this area of my chest. I don't know if it's lung, I don't know if it's heart, don't know if it's general inflammation. No one really cares, other than it's getting better. And I have had all of those investigations and nothing has really come back with anything. But I would urge you, if you haven't had any investigations, to at least get an ECG done. And as Andrew and I were discussing earlier, many people are turning up in A&E now with these symptoms, because, you know, there's no answers from your GP. And so Andrew is seeing people come with long COVID to A&E with a racing heart. And if you have an ECG, then at least that can rule out signs of, you know, any inflammation in the heart or infection. It's most likely to be what we call a sinus tachycardia, which is a normal increase in heart rate. And we often see that as a result of this increase in sympathetic nervous system function that I mentioned, which is a hallmark of long COVID. So why it's not nice, it is quite benign. Sorry, when my neighbour's dogs come in to say hello. Yes, it is benign and it can improve. One of the things that really does help people often is the use of antihistamines, for example, and that certainly improved my tachycardia. And this is because, and we'll come to this again, histamine is a mediator, and as a mediator, it can trigger increases in heart rate. And once a mediator of inflammation, I should say, and once you suppress that, you know, that trigger, that sign to your heart is being dampened down, so that can improve. And that is certainly what I see anecdotally in myself and in others that I've treated, and reports back from other specialists also. So I hope that helps. I know that breath work, do watch the video with Jez, because we explore this dysautonomia and all of the things that can help. If you do have it persist, you might want to go back to your GP and get referred to a cardiologist. Some people are taking beta blockers that I've mentioned, propranolol, or something called I can never pronounce it, ivermectin, which is, it can be used to affect the rhythm in the heart. So a cardiologist would need to, or a physician would need to prescribe that. But I really see a benefit from a histamine approach for these symptoms that you're mentioning, working on your breath, working on other things that stimulate parasympathetic nervous system function. for sure. And also general anti-inflammatories like high doses of fish oil and something called quercetin phytosome, which are natural anti-inflammatories.
I agree, and I'm like Tamsin, I like to know what I'm treating, so I like to be quite sure that everything that's worrying has been ruled out. So a very simple heart tracing, some simple blood tests are a really good starting point, because I won't just recommend, oh, I'll give you this treatment for this symptom and this. So I want to know that you're safe. And so that very basic workup for me is really important. I think a lot of the other suggestions Ham has made, once we know that you're in that place of safety, are really helpful. I think the only thing I'd add to that might be magnesium. Most people seem to be deficient in magnesium. It's involved in about 600 biochemical reactions in the body, including the mitochondria, but also for people with rhythm disturbances, it can be really helpful. It also helps to reduce muscle cramps, and it also helps you to sleep. So it can be a really helpful mineral in those situations. And then everything else that Tamsin's mentioned as well, I think would be good.
Yeah, and so electrolytes, I think if you looked at the supplement video I did, I showed this thing called electrolyte synergy, which has really remarkably helped me and many of my patients, and that contains magnesium and quercetin. So if you're going to use magnesium, be aware that magnesium oxide and citrate really do stimulate the gut. So use one that contains either magnesium glycinate or magnesium threonate, both of which are quite calming, but also transdermal use of magnesium. So those Epsom salt baths can be really helpful. So Nicola said that her cardiac investigations have been normal. I would really urge you to look at the histamine approach that we'll come to shortly as well, because that has certainly helped many people.
Okay, so the next kind of heading is on pacing. So we had a couple of questions on pacing. What are your thoughts on pacing? There seem to be two camps, one for, one against, but I can never find any real reasoning behind either or what the correct course should be. Personally, I feel like I've been pacing for 13 months naturally just to get to where I am now. So is there really any more to it? And then the second one is, how do you pace successfully when trying to exercise? Maybe we can kind of encompass those two together.
Yeah, I'm probably the worst person to answer this because I'm officially crap at pacing, excuse my language, with my athletic history. And I think one of the reasons I've ended up with long COVID and many other people with previous athletic histories have is, failure to rest in the first month of infection. But we weren't told back when I had it at early March in 2020 that you should rest. It's in us to kind of want to move and push back. But I think it's important the one takeaway on pacing is it's different for everyone. Okay. I do think that any intensity of exercise where you are impacting your joints is going to trigger inflammation more than doing exercise that doesn't have an intensity aspect or an impact aspect. And that can be swimming, yoga, walking, etc. Is better for the body. The one rule I would give is when you come back from any degree of exercise or movement, let's just forget exercise, because we're not going to be getting in the gym doing weight training. We all know, well, most of us know, that the graded return to exercise that has been advocated by chronic fatigue clinics is actually been proven to not be helpful. So I would say, come back feeling like you could do more, okay? And I would also encourage you to have a meal within an hour of you doing any form of exertion, where your heart rate goes up at all, because that will funnel in, that will give you a signal to your body it's in a sort of non-stress state, because it will feed and give your muscles fuel. And then I would also encourage you to diarize or build into your day a period of rest. If you know you've got activity, be it cognitive or physical, I would ask you to diarize in 30 minutes minimum in the afternoon, where you can lie down, do some breath work, meditation, or other things more extensively nourishing, like massage or acupuncture, etc. I think it's really important to diarize that in, and it's not convenient in our busy lives, but it's essential in recovery from my experience.
Totally agree. And my take on this is I always try and get my patients to get them to listen to their body at the end of their day and say, well, I've just done this bit of activity today. Could I do this again tomorrow, or am I completely flawed? And I think if the answer to that question is I'm completely flawed, they probably overstepped the mark and probably need to drop back a little bit. And I think the diarizing is really helpful to record what activity you're doing, so you can kind of monitor your progress. And I think the other thing is, do not try and set yourself unrealistic goals. You're not trying to achieve what you were doing before in the well state. You've got to be really careful and go easy with this. It's really easy to floor yourself with exercise. So you've just got to get rid of, if you are doing these massive exercise feats before, triathlons or whatever, don't even think about that. We've just got to think about what you can do in the moment and just gradually increase without flooring yourself, because there's nothing more of a psychological setback than going backwards. You do something, you feel terrible for 3 days and need 3 weeks off. We want you to be able to get to a level and gradually increase your aerobic capacity without flooring yourself. And I think it's about being careful, listening to your body and diarising it, just so you've got like a record of what you're doing, because you will probably find that you are doing more with time as time goes on. And that's quite encouraging psychologically. That's my kind of spin on it.
I agree. And, I've found that in my own experience where you're, when you look back on it and you do still get tired, but you look about what you've done, that you will realize that, as opposed to 2 months ago, you're able to do more incrementally. Yeah.
Okay, so we've got a few questions on medications. The first one is about, I'll just read out the question anyway. My condition is very much fatigue-based, almost ME-like, but without the brain fog, and seems to be perpetuated by some form of inflammation. I found that COX-2 inhibitors massively reduce my symptoms. However, I want to know if these are okay to take and are actually helping my recovery, or if they are simply covering up symptoms while I do damage to myself. I worry they provide me with false confidence. Is it okay to take them?
I mean, I can let you answer this if you want. I think just on a high level, I would suggest that inflammation generally is higher post-COVID. So by quenching some of that inflammation using a medication like this is not a bad thing, as long as you're not, consistently you're doing okay and you're not having mini relapses along the way. What do you think, Andrew?
Agree, and there's no doubt about it. This is an inflammatory illness, and by taking an anti-inflammatory, you're going to give yourself some symptom relief. I agree with Tam. I just don't like people getting addicted to these things. It's very easy to get into a pattern of taking anti-inflammatories or painkillers in general. They aren't without side effects and problems in the long term. They do cause damage to the gut, particularly bleeding in the gut. They damage the gut barrier, which is, we're always trying to keep the gut barrier healthy and intact. So I think for some short-term symptom relief with people who really are suffering, helpful, but try and keep it a short-term thing would be my spin on that.
Yeah, exactly.
Then there's a question about antihistamines. I've been taking H1 and H2 antihistamines, but the H2 gave me a dreadful tummy upset and I'm feeling more tired than normal on the H1. Is that normal?
1 second. I was just answering one of the questions very briefly about antihistamines. So antihistamine therapy is becoming one of the hallmarks of treatment of long COVID in many people because of the reduction in inflammation. And I know we've talked about inflammation and COX-2 inhibitors, but antihistamines can help with the inflammation as well. So I'm sorry you haven't been dealing too well with them. Most people tolerate fexofenadine. It doesn't tend to cause sedation. So if you have had sedation with it, then I would go back to another antihistamine and try others. There's one called Rupatidine, Rupatidin, which is a prescription antihistamine, which could be helpful. Before that, you could try cetirizine or loratadine, which are both over the counters, but you need to take it, 2 to 3 times a day to have a real impact, which is more than most people would take. And then famotidine, if it causes those symptoms in you, then clearly it's not the right one for you. I would switch and use high doses of quercetin, or potentially look at your gut health in more detail. Because in some people you can get sort of an opposite effect, and by blocking the histamine receptors in the gut, you can get hyperacidity through the increase. In some people it can affect them that way. So if it's causing those symptoms in you, then clearly it's not for you. You may want to experiment with probiotics. There's something called Prohistamine X, which is a probiotic with high doses of lactobacillus that can help. But looking at your gut health in more detail would certainly be helpful, I think. Yeah, so try another antihistamine, work on your gut health, but stop the famotidine.
Yeah, pretty much agree. And I think antihistamines is very much a trial and error in this world. We never know which ones are going to work for which patients. We never know what the side effect profile is going to be. So it's really about trial and error. If one isn't working, and then try another one. They've got very similar side effect profiles, but we just don't know who's going to get which side effects. So it's a bit of trial and error. And the reason that they're useful is because the whole long COVID activating mast cells and the whole histamine response that we get from that. So again, looking at the gut, really helpful. Stool test can be helpful, tells us exactly what's going on in the gut. There may be things that we can treat by rebalancing the gut, which will reduce that whole histamine response. So all of those things I think are worth looking at for people with those symptoms.
Yeah.
Let's
investigate antihistamine. If you need, we can answer those questions for you via email. And if you want to get a prescription or talk to us in any more detail about doses, etc. So we've got a few minutes left to answer different questions. Do you want to pick one of the most?
Okay, let's have a look. I think you've kind of talked about this one already, but there is a question about positive mental attitude and what do you think of something like the lightning process? I know you alluded to that earlier on, but maybe just in the broader sense of positive mental attitude, I think would be a nice sort of one of our closing questions to address.
Yeah, I mean, we'll send out the link of the video I did, and I think we covered a lot of that there. And Ashok Gupta, has a program similar to the lightning process, if not, more comprehensive. I really think you have to find, a lot of it is based on, deep meditations, encouraging a sense of joy, of bringing back this concept of cell safety or a physiological safety, like us being safe. COVID, for many of you, threw a bomb through your worlds and went, and suddenly everything felt very unstable. So I think really looking for sources of joy in your life is really important. Connecting with loved ones, doing self-care, massage and acupuncture, and taking yourself away on a spa retreat when we can, etc. Spending time in nature. Really taking time to breathe and thinking about yourself in a version of yourself that you want to be. So this is this concept of visualization, of positive mental attitude, and many of these programs encourage the same. I did a lot of work in the past with Joe Dispenza, who has written many books around positive mental attitude and breaking the habit of being yourself, etc., etc. And the whole idea is that this is this framework of we become what we repeatedly think we are. So I think, defining ourselves as having a chronic illness is therefore going to make us feel like we have a chronic illness. So sometimes breaking out of that with this positive visualization and, the support of groups, like the lightning process. I don't know it specifically. I do know Gupta's program. I do know Joe Dispenza's retreats. I've been on them personally. And I think it can really make a difference. But, as long as you know that it is because the brain and the body are so entwined, that we really can think ourselves into being healthier. And that is what broad, very large scale studies show that positive mental attitude is associated with multiple reductions in all causes of disease and mortality. So, but, again, it's commitment as well, making time for practice and self-care.
I've got a really useful adage for this, and it's this: whether you believe you're going to recover from this illness or you're not, you're probably right. And so I think positive mental attitude is huge. And we all know about the link between the brain and the body, and the more positive you are about navigating through this and recovering, the chances are you probably will. And I think maintaining that through whatever support mechanism it is, through groups and platforms such as this, but also the program that Tamsin has referred to, just to help that whole positive, the whole psychology of this illness, are going to be really helpful. So I totally agree. Positive mental attitude is everything.
Yeah, absolutely. And just to finish up with answering one of the questions that we've had a few times from Sammy is saying, do we think this is going to open up large scale, much needed research on chronic disease and illnesses like dysautonomia and fibromyalgia, CFS, etc.? And yes, I mean, it clearly is. Dr. Paul Glynn, who is my physician up at UCL, is engaged in big trials of treatment trials of antihistamines in long COVID, but also looking at mast cell precut, a whole range of different aspects here. So no doubt we are going to see a tremendous amount of research coming out into chronic illness and that we've discussed. And also people are saying don't exercise, but isn't one of the main recovery strategies lower limb exercises? I think you've got to tease apart strategies for exercise and then recovery from POTS. You know, clearly too much exercise is going to trigger inflammation, which is going to make things worse, which is why only doing small amounts of exercise and allowing recovery is important. But lower limb exercise for POTS is just stimulating blood flow, which can help improve which can help prevent that postural drop. So I hope that answers your question, Sammy. I think the two are separate things. But POTS has to be salt, fluid intake, and everything, and looking at antihistamines, a mast cell stabilizer potentially, and then all of the lifestyle techniques that we've mentioned already.
Okay. I actually have a couple of questions about the whole what's happening globally in terms of governments. And I think there is a move. I mean, the fact that the NHS has set up a network of long COVID clinics is a very significant move. And it's also helping to validate some of the other illnesses that Tamsin mentioned, you know, the chronic fatigue, fibromyalgia, because this is an iceberg. You know, we're still in the very early bits of the pandemic, in the sense we're still in lockdown. We're just trying to get over the acute phases, but the long COVID is really a massive iceberg. It's the next thing coming along, and we all know about it on this platform, and you guys are here because you're concerned about it, but it's the next big thing. And I think the government are going to have to commission more research and put more services in, because it's affecting so many people. Somewhere between 20 and 30%, that may even be a conservative estimate. And I think it will also help the other groups of people with chronic illnesses. So I do think there'll be some things happening globally with this.
Absolutely. I think it's important, the positive mental attitude. Serotonin is one of the key neurotransmitters. And we're going to finish up here, but I think it's important for you. If you are struggling with mood symptoms and predominant fibromyalgia, muscle aches and pains, etc., please do talk to your GP, and don't be shy about considering, or us, you know, we can do a private consultation if that's something you wanted to look at. But looking at potentially using SSRIs like citalopram or fluvoxamine is being talked about a lot in the press at the moment. But whatever, you know, boosting your serotonergic function is really important in helping those symptoms also. And we'll potentially do a whole webinar on mood and serotonin separately. Take care, everyone. It's been really nice to see you, and we'll touch base with you soon, but do send us any questions on email if we have.
Yeah, thank you very much, everybody. Thank you for coming along. Thank you for all your wonderful questions. It's really given us a lot to talk about this evening. So thank you very much, and we hope to see you on our next broadcast.
Take care, and sending love and healing to you all.
Likewise.